I am going to get started now. Hi, everyone. Thank you so much for being here. Welcome to this session of the 2025 Culture of Data Conference. My name is Rita Rochelle. I use she, her pronouns, and I will be moderating this session. We're also very lucky to have Dennis Wright. He is here help managing Zoom and making sure that tech is running smoothly. You are all muted right now, but if you have a question during the Q&A session, you're welcome to unmute. You're also welcome to chat any questions that you have during the presentation as well that we can get to during the Q&A. If you are comfortable doing so, please add your pronouns to your Zoom name by clicking the three dots on the video square and selecting rename. So we are going to have one presentation during this session. They'll be presenting for approximately 25 minutes, and then there will be 10 minutes for Q&A afterward. We'll finish this up with just a few announcements from me before a break before your next session. Now, the presentation that you're going to see today is going to discuss data from the Healthy Kids Colorado survey that relates to mental health and suicide prevention for adolescents during and after the COVID-19 pandemic. Our speakers will explore the impact of free counseling initiatives as it relates to health justice. I'm now going to turn it over to our speakers, Margie Day and Heather Brown, to present Leveraging Data for Youth Suicide Prevention in Colorado. All right, you can take it away.
Well, thank you. Welcome to our session today. And let me just go ahead and share my screen and then we will get started. So today, just to introduce myself, I am Dr. Margie Day, and with me is Dr. Heather Brown. We are going to share with you suicide prevention opportunities regarding intervention. And just to kind of preface our talk today, I just wanted to go ahead and say that we have no relevant financial relationships with any or commercial interest with what we're be discussing today. But I would like to just offer an opportunity for all of us just to kind of sit for a moment and really what I'd like to do is help us before we dive into our data to really bring a voice to the data, which I feel is very important, especially with the topic in which we're going to be sharing today. So what I'd like to do is share a poem, and with that poem, it's titled My Generation Bleeds, and I really want to put a voice to the data. So if you don't mind, just kind of sit back and let me share My Generation Bleeds. Mental illness. They mock, they laugh, but they have not seen. They have not heard. It's not just a quirk. It's not just a plea. We need more attention. They blame the phones, the screens they've made us slaves to. We scream and we cry. My generation bleeds. How many more of my classmates must die before you hear our beyond desperate cries? If you want to lose your faith in people, just watch the nightly news. Another mama's boy gone killed, another daddy's girl gone raped. Our planet burns, our mind screams. 10 hours of sleep for you teenagers, that's what they say. But when it's buried in schoolwork, when do I rest? Because we got to study for the SAT test. Go to school and change the world. But when the world is closing in and reality is collapsing fast, where do you turn? How long does the average panic attack last? We scream and we cry. We bleed and we die. You're not smart enough. You're not good enough. You're not pretty enough. You're not. You're not alive anymore. But you were such a good, sweet, smart kid. Everyone loved you. They lied. We scream and we cry. We bleed and we die. I wanted to share that so we recognize that the impact that what this really represents when we consider the data that we're going to be sharing. So just to give you kind of an overview of the topics we're going to be discussing, we are going to provide sort of an overview of the Colorado service data. We're going to share the impact that the 6 pillars has on the kind of the reach of that data. We're going to talk about trends and protective factors, and then we're going to take the content and the items that we've shared with you, and I'd like us to kind of work through those through a scenario. And then, of course, we're going to share our next steps. So next, I'd like to take a moment to look at the layered impact of suicide prevention. Really, when we think about suicide prevention among Colorado youth, it really is indeed a multi-layered approach. It's rooted in, as you can see, these 6 foundational pillars. And something to emphasize is that each one of these does play a crucial role in establishing a comprehensive and an interconnected system of support. So when we really consider the Colorado data and looking at those suicide rates, each one of these pillars must work in tandem, must work together with each other rather than in isolation, so that they can really create a strong, coordinated network that can address prevention strategies, not only at the individual level, but also at the community and those systemic levels. I also wanted to just kind of share some of the key takeaways from that. And really what that is really looking at that suicide prevention, there is not just one single isolation, there's not one single solution, but it is definitely a layered and very comprehensive approach. So when we think that a single intervention is not enough, but we must really think about all of these sort of working together, interconnected really, to build a stronger, more effective safety net for our youth. So I'm going to begin by introducing you to some national data, and then I'm going to hand it over to Dr. Brown, and she's going to kind of dive deep into this Colorado Healthy Kids data. But as you can see here, suicide is indeed a very, really pressing problem within our country. And suicide is the 2nd leading cause of death of U.S. children, adolescents, and young adults ages 5 to 24. And then what I also, this is the last national data I'm going to share with you, but I want to just capture this in thinking that just today, just right now, when we think about this 24-hour period that we've been given, there will be over 3,400 suicide attempts from high school students in our country. And what that approximately means is that 1 in every 15 high school students will attempt suicide. And next, I'd like to hand it over to Dr. Brown.
Thanks, Margie. So as you know, we live in a beautiful state. We're one of the wealthiest and healthiest. We have 300 and some plus days of sunshine, but sadly, we still do have that high significant rate of suicide. It was at an all-time high in 2017, leading cause of death for age 10 to 24 years. And 10 is quite young, but they're younger ages of suicide attempts and completion is what is being seen. And I want to make note of this because this was before the pandemic. We do know some significant mental health effects post-pandemic, but 2017 was well before that, and we were already seeing a significant high incidence of suicide, again, leading cause. 2023, 2nd leading cause of death, Colorado and the United States for ages 10 to 24. And that, again, is motor vehicle accidents kind of ranges up in there too, and these 2 categories kind of go back and forth on that. Many of you are probably familiar with the Healthy Kids Colorado survey dashboard. I'll just mention it. It's given every 2 years in schools and through various counties. And this is available data that you can access, Healthy Kids Colorado survey dashboard. You can type that in. The most recent data we have is 2023. It will be given again in 2025 in the fall, and then that data comes out the following summer. This looks at mental health, it looks at risky behaviors, safety, violence, many different areas, and you can pull down the tabs and look at what you're interested in. We specifically looked at mental health, and we looked at, we live in Pueblo County, but then we also looked at Colorado data overall. But it's a great resource to learn about your county and then also nationwide. And about 100,000 plus students take part in this survey. And we'll dive in a little bit on the data here. This is 2023 again. It will be given again in the fall of 2025, so we'll await that data. But I wanted to note that specifically 75% of youth had an adult to go to with a serious problem. So that still means 1 in 4 do not identify someone that they can go to with a serious problem. I'm a fan of Brene Brown. She is a social work researcher And she talks about one of the best trajectories for a child's life is if they can count on one adult. It may not be a parent or guardian, but if they have one adult they can go to. But we still see that 75% do have someone they can go to. 58% of youth agreed their stress level was manageable. This was better than 2021. So 2023 showed some promising mental health findings. And this was really significant if you look at the middle point there. In 2021, 40% of students reported feeling depressed, and that means sad or hopeless. And there's a phrase that said, hopelessness is lethal. And one of the big predictive factors of suicide is hopelessness. So in 2021, 40% felt feelings of sad or hopelessness. Thankfully, in 2023, but 26%, a very significant difference there. So that was an improvement. And we'll talk about some of the reasons that the theories behind why that looked better. And then down in 2021, 17% had considered suicide, down to 11% in 2023. And then finally, the last suicide attempts were 7% for those 3 points of data there, and then down to 5.5 as far as suicide attempts. And I'll just note our Pueblo community mental health findings. We had higher rates there, especially in that middle point 49%, almost half of youth in 2021 felt sad or hopeless. And that number did improve to 31% of youth experiencing feelings of depression. We had a little bit higher rates of the considered suicide and suicide attempts in our Pueblo community, but still saw a difference in 2023 of those rates going down. So why did this happen? Some reflection that was found on the Healthy Kids data website that they had inferred were from 2023 to 2021. They took some student statements and kind of looked at qualitative there, and students identified perhaps more peer support. That return to in-person setting was maybe one of the other factors that helped improve mental health. And then I think we have seen this across the nation, thankfully, some destigmatized mental health support and increased support in the schools. And it's just not as stigmatized. Students readily talk about their mental health, thankfully now. The CDPHEA statement in 2024 said it's improving. This is a hopeful indicator that some of the interventions are paying off, specifically some school programs. And suicide prevention models led to 29% decrease in attempts. The progress is moving forward, and we're happy to see that. And then finally, health disparities. We do need to note health disparities. It is noted that transgender youth report 3 times the rate of unmanageable stress and 4 times the rate of suicide attempt. This is a vulnerable population. This can be from various factors. Love and belonging, as we know, Maslow's hierarchy of needs. If they're not feeling that love and belonging, that can lead to the hopelessness and sadness, hence the increased risk of suicide ideation. Lesbian, gay, and bisexual youth have a 3 times higher rate of suicide. And this is how the data was broken down for the Healthy Kids, was transgender category and then lesbian, gay, and bisexual youth in 2 separate categories there. And keep in mind that this may be happening at home where they don't feel the love and belonging, and they may have no one. Again, that one person that they can go to, they may feel that they have no one. Could be a reason for, again, those higher rates, 4 times and 3 times higher rates of suicide.
So next, what we'd like to do is share with you some risk factors and warning signs. And risk factors and warning signs, they are indeed different. So when we think about risk factors, these generally are, characteristics that are indicative, of imminent harm. And then when we think about risk factors, this is indicating that someone is at a heightened risk of suicide, but provide no information and about the urgency of the risk, or if it's even immediate. So, and warning signs indicate the immediacy of risk. So what are some of these warning signs that we see? We see it in suicide threats, previous suicide attempts. These are all things that to take note of when working with populations. Alcohol, prior alcohol and drug abuse. They may make statements revealing a desire to die. There may be a sudden change in behavior, depending on, the context in which you work. As a professor, if we notice, students that are generally in the front row, very participatory, as we notice weeks go by, they start moving toward the back, or they start stop interacting, or you notice a real strong change in a behavior. There may be signs of prolonged depression. Maybe they're making some final arrangements, giving away prized possessions, purchasing a gun, or stockpiling pills. These are all warning signs and need to have action. So I wanted to share warning signs with the idea of fact. So first, we consider feelings. So feelings are often things that students often experience extreme feelings, which they may or may not be able to identify, but they can speak to. So examples of these extreme emotions might be rage or homeless, kind of hopelessness. Not being able to kind of see a future. I think all of these are very important. Then the next is we go from feelings, displaying certain emotions, and then we go to actions. What are they doing? What changes have taken place that have kind of raising that flag to you? You may see it in school settings, you may see it in public health settings, we can see it in classrooms, or even in people that you interact on a daily basis. So things that you might take note of would be like impulsiveness. You may notice a decline in the quality of work. They may start complaining about physical complaints. So we have feelings, we notice changes in emotions, and then we're going to have actions. People are changing in their behaviors. And next, we just want to notice change completely, right? So things a student or an individual does that are out of the ordinary. Examples of that would be sort of an intolerance of praise, or maybe withdrawing. And the final one I'd like to share, so we've done feelings, actions, and changes. The last one is looking at threats. Threats are real. If somebody's making an overt and explicit declaration to harm themselves, and it can come in many ways. It can be verbal, it can be nonverbal, it can be written, but definitely look for these signs and really, take action. These were just kind of to look again at looking at risk factors and just wanting to make sure and kind of really get these across. If somebody has had prior attempts, or if they're noticing a change in those, being impulsive, even if they have a family or friend that has had a suicide attempt or died of suicide, other reasons to really pay close attention. Do they have access to lethal means? Are they engaging in substance abuse or use? Do they do self-harm? Are they having bullying done, or are they in a situation where they may have a mood disorder such as depression and anxiety? And I'll pass it over to Heather.
So here's some interventions. We like acronyms. ACT is a nice acronym to keep in mind. Of course, ask and acknowledge. And depending on your role, this is kind of where you will ask some of those direct questions, again, depending on your role and relationship and the resources in place. You come to them, acknowledge that you have a concern, and ask, and depending on the scenario and your resources, you may ask those tough questions of, do you have thoughts of hurting yourself? Do you have thoughts of ending your life? Do you have thoughts of suicide? And then, of course, care and concern. People want to be seen and heard, and we're all in many of you are public health or in a profession of helping, and I'm sure you all do this well, but show that care and concern, but recognizing those at risk. And then talk or tell, of course, this is where you intervene. And this is, I like to say, you want to overreact instead of underreact. Don't think, well, I don't really think they're suicidal or that, but you want to overreact, over intervene, because it's better to over refer or get resources than to let that person go out of that setting without having some resources. And we'll talk about some of those resources. Another thing is QPR. It's called Question, Persuade, Respond. And those trainings are available throughout different settings. My background is I'm an undergrad nursing professor and pediatric nurse, and we've implemented this for our nursing undergrads. They all attend the QPR training, Question, Persuade, Respond, suicide prevention training, and get a certificate. And it's helpful for careers, but it's helpful, goodness forbid you ever have a loved one or someone you're with and you need to utilize some of those resources. So I just wanted to mention that as an option also. I Matter is a program that came about in 2021 after the pandemic through the Colorado Behavioral Health Association. And this, if you're not familiar with it, offers 6 free confidential sessions for children 12 to 18. So even as young as age 12 can receive mental health counseling services through this resource without a parental consent, and even up to age 21 if they are developmentally delayed. But again, 12 to 18, 6 free counseling sessions. And I checked this data recently. Since it has been implemented in 2021, they have served 14,000 individuals through their services in, I believe, 62 out of 63 counties. And then referrals from there. And the data said 80% from this program received further referrals. So it may need to be referred out to like a psychiatrist or some behavioral health, where maybe medication is needed or further services. But it's an excellent initial program. If they do readily give out pamphlets and stickers, and you can place those in settings, I hand them out throughout the semester. I'm also raising 2 teenagers, and I saw it at my son's school, and I was so happy they had all those brochures available for students to just grab. So through imattercolorado.org, you can readily get pamphlets, stickers, just to get the word out about that program. And finally, I'm sure you're all familiar with, but 988, this came about in July of 2022. And since July of 2022, I checked this recently, they have serviced 14 million people through intervention. And you want to give this line as a crisis line. It is also as a suicide prevention. They can talk, they can chat, or they can text, any form there. I do want to mention, though, this is kind of in the early stage to call when there's a crisis, before there's an active suicidal ideation. Of course, an active suicidal ideation, where you have fear someone is actively going to hurt themselves, that is a 911 emergency or emergency department visit. But I readily give out this number if you've ever been in the hospital lately. Before you ever leave the hospital, on your discharge paperwork, they give out this 988 number, no matter what you were there for, just to get the word out. So helpful resource there, but to use it early on to get the mental health intervention. Again, active crisis 911.
So next, what we'd like to do is introduce a scenario. And I would love to see in the chat your responses. And let me go ahead, and we're going to, because of time, we're going to share scenario number 3. And scenario 3, let me just read that to you. And what I'd like you to do in the chat is to share with us, what are some warning signs? What are some behaviors? What are next steps? And what do you think we should do to help Tony? So let me read that scenario to you, and just go ahead and, fill in the chat. So Tony, he is a transgender student. He discloses to you that he has been bullied for being a non-white transgender man. His classmates belittle him repeatedly, and he has no friends. Tony feels disrespected, humiliated, and ashamed of his gender identity and ethnicity. He says that he's having trouble thinking clearly and is at times tearful and shakes uncontrollably. When you talk to him, he stares past you without saying anything. He expresses feelings of low self-worth, loneliness, despair, hopelessness, anger, and he has stated, "I don't have any friends anymore because I'm such a loser. I wish I could be comfortable being a female, so I don't have to be this. I hate being trans. Why couldn't I be born in the right body so people would accept me, maybe even love me? I didn't choose this. I just want to be normal. I'm done with my life. I can't do this anymore." So what are some warning signs that we see with Tony? And Rita, maybe you can help me with the chat too, if you see, some filling in. But what are some warning signs that we are saying? Absolutely, Joseph. Thank you. Being bullied. What else? What else do we see with Tony? Ending life? Absolutely, Lynn. Perfect. Absolutely. Anything else? So, we see these are some behaviors. Low self-worth, ambivalence towards living. Absolutely. And I think the feeling of disrespect is definitely important. Yeah, absolutely, Joseph. So when we start, anything else? Distancing? Absolutely. And maybe we'll take a few more. Anything else that kind of jumps out at you that would be something that you take a little more note of?
I look at, I'm sure somebody's thinking that, but hopelessness, and remember kind of that quote is hopelessness is lethal. And he definitely demonstrated those statements there.
And lack of love, a lack of feeling love, absolutely. So now that we've kind of identified some of those warning signs, what would you think would be the next step? And would this be something that we should really, should this require sort of a quick response? What would be your next steps? And you want to add anything, Heather? Open a conversation? Absolutely, absolutely, James. That, and really using those kind of open-ended questions. What are some things that we'd really want to think about when starting that conversation? Anybody have any thoughts? Absolutely, absolutely. So when we're opening our conversation with Tony, what would be some techniques or ways of doing that in a way that would open that conversation? Anybody have any ideas? Offering a safe space, absolutely, friend. To me, I think that's the best place to start for sure. Because really, when we have somebody who's experiencing these emotions in this place, we often, we don't ever want to just jump. We always want to kind of offer that safe space, and just to be present with them in that moment, right? And have them open up to you, to know that they have someone to come and connect with. Anyone else have anything else to share?
And I know, and it depends on your setting where you're at with this individual, but this would be a point where you ask those difficult questions. Are you feeling suicidal? Do you have thoughts of ending your life? And then, as many of you probably know, the next question is, do you have a plan? And if that individual can detail out a plan, that is where you have imminent risk of a 911 or emergency department setting needed. I do appreciate in the chat, do you feel safe at home? Absolutely. We do know that home is not a safe place for many individuals, and school may not be a safe place. So then where do they have to go? Thank you for sharing that.
Absolutely. And so just to kind of reflect, when we're facing this sort of scenario, we always want to look for changes in mood and behavior, which you all did amazingly well. And then we want to ask directly, just as Heather shared with us, ask if there's plans. Do you plan on doing this? Be direct, but in a very empathetic and caring way, But again, you always want to establish that safe space first. And state your concern about these changes, and then connect them to resources.
I wanted to share this. This is more in a controlled setting. You wouldn't administer this, but if anybody is in a setting where it's a health clinic or you have provider access, the recommendations, the AHRQ, the recommendations for annual screenings is that every year teens should be screened for suicide and depression. Here's a depression screening, the PHQ-9 modified for teens. This is one of the better screening tools out there for depression because it does include the suicide questions. Specifically, and the one that I think has an impact and good to ask is, have you ever in your whole life tried to kill yourself or made a suicide attempt? So again, a PHQ-9 depression screening is done at that visit. And maybe that individual is doing fine. It's summer, they're out of school, the stressors are mild, and they're doing well. So it's really important for a provider to know, though, in that history, in their whole life, well, yeah, 5 years ago, I did have a situation where I made a suicide attempt. So this is an excellent screening tool that incorporates that in there. Again, everybody should go for their annual screenings, and this would be something your provider's asking, but this is a tool that incorporates that question because it's really important to know that as a history. And just a couple other little notes on suicidal ideation. There is passive suicidal ideation where someone may say, I just want to go to sleep and never wake up. And that is a passive suicidal ideation to recognize. And of note, again, also is sometimes there are no signs. We talked a lot about signs and sometimes individuals will hide their suicidal thoughts, and they may seem like they're doing just wonderful, maybe after a breakup or after something distressing. And that is sometimes because they don't want anyone to intervene. So I think that's worth mentioning because there can be, when families lose someone to suicide, guilt with that if we didn't recognize it. So I do think it's worth noting sometimes there are no signs and you won't see that. Protective factors, will end on some positive things here. Those with clear family rules were less likely to consider suicide. If they had an adult to go to, that was a protective factor. If they felt safe at school, which most did feel safe at school. And then sleep, I think we sometimes discount the importance of sleep, but it significantly affects mental health and performance there. So if they are able to get more than 8 hours. It truly is a benefit. And these key takeaways, we had already mentioned this data in our presentation, but again, 75% have an adult they can go to. 70% of youth did have poor mental health during the pandemic, but things are moving forward. And again, from 40%, now 26% report feeling hopeless versus that 40%. So definitely seeing some progress and some positive things forward. Just our research, we were able to present at a Colorado School Nurse Conference to 80 school nurses and share this information. And many had programs in place, and some were aware of most of these and some were not. So that was part of our next steps. And then we would like to continue implementation into schools and maybe on our college campus because we have that population available to us also. And we want to end with a positive quote here. Resilience is not about being unbreakable. It's about being able to put the pieces back together and continue on with renewed hope and courage. So we thank you for your time and your commitment to this topic and appreciate, we'll open it up for questions.
Thank you.
Thank you.
Wow, thank you both so much. That was an incredible presentation. Yeah, as they both said, I'll invite everyone here to either put a question in the chat, or if you click on reactions, there's an option to raise your hand. If you do that, I'll go ahead and call on you so you can unmute to ask a question yourself. But I'm going to get us started because I have a lot of questions from that presentation. The first thing I wanted to ask, looking at those warning signs and risk factors that you guys talked about, do those look different in people with different backgrounds or cultural differences? For example, do men and women have warning signs that look different for suicide?
Yeah, we can't speak to cultural differences. I mean, typically gender, males, and then we did note Hispanic heritage specifically, and other certain cultural backgrounds will be more stoic and have maybe more of a stigma about sharing their mental health concerns and may not show those typical signs. It might be more pulling away. And you had looked at that with specific Hispanic male, and mental health was one of our other.
No, I definitely think that is something that we must take into consideration, that, no matter what we're discussing, we always have to consider the individual, right? And what that looks like. So for sure. Yeah, thank you, Rita. That was a great question. I think that is, very important to always remember, for sure.
And other cultures that have high standards of achievement in that, they do have those increased risk of suicidality. That's been noted in research, obviously, too.
But I do think we have to kind of also make sure and capture that those are signs that are the most obvious and the ones that we see, right? No matter, across the board, right? I think that's pretty important to capture.
Absolutely. Yeah. I actually grew up in El Paso County, and growing up there, we heard very often that the suicide rate there was a lot higher than other places in Colorado. I'm curious, you guys also cited some stuff from Pueblo. Do you have much information about different suicide rates across the different communities and things like that?
Mm-hmm. We did look into our own county, Pueblo, and as you could see, our data was higher significantly on the hopelessness, the depression, the rates of suicide, and that. And then we did look at El Paso County, and we didn't delve into that, but you are correct that there were higher rates there. Again, and we do have a high rate of poverty here in Pueblo, and our local health department has picked 2 initiatives. One of them is risky behaviors, and one is mental health. And for Pueblo, the anecdotal theory is that poverty is a definite element there of increased risk of depression and suicide. So I can speak to that as far as Pueblo. El Paso County, I don't know. I anecdotally, again, have heard sometimes a lot about military, higher rates of military service there. But again, that isn't anything I can statistically point to, but something I have heard. And I'm sure there's probably some experts on this call, but if they would like to jump in and share, I know a couple people we had collaborated with on some data are also on here. So again, we'd welcome anybody if they have anything to share. That would be helpful too. Thank you.
But those were great questions. I appreciate you sharing those.
Yeah, absolutely. Yeah, I mean, I think it's a very interesting topic, for sure. And I really appreciate the time that you guys spent talking about, just as like an individual too, I think, thinking about those risk factors if the people I interact with, as well as in my work. You mentioned that you guys shared at a conference as well with some school nurses and other individuals. What was their reaction when you shared this data with them and information?
At our, go ahead, Joanne.
Oh, go ahead.
Yeah.
No worries, Heather. Go for it.
At our school nurse conference, we did just a little informal survey, and there was about 80 Colorado school nurses, and just as mental health ranked as a priority for them, or we think of like kids coming in that need an ice pack or a Band-Aid, and the vast majority, I think it was about 75%, noted the mental health was definitely in the top 2 category of things they deal with on a daily basis, and many were familiar with the resources. They did, a lot of them had the iMatter that they have used in the school. And, they are the experts. They know their schools and that. But I felt the benefit with some of those things is it hits those rural areas where they can do telehealth or something like that. And what was your takeaway from?
I felt that they also seemed very informed, and I'm part of what we were trying to explore was what we could do to, kind of improve their, capacity to help the youth that are sitting in front of them. And it seemed that they were pretty, had good systems in place. They had good support, outside of the school nursing. They had the counseling, and that seemed as if there was a lot of support for the students. And I thought that was a really refreshing takeaway. I do think one of the things that I find is important, is we've presented this several times, is really just having the conversation. I think it's very important that we, have the conversation, and open the eyes to that these are still issues that are uncomfortable, but they're important to talk about. And how can we raise those conversations and help, address the stigma so people feel comfortable sharing when they are in need, right? And also for someone who's sitting next to that person feeling comfortable, well, I can make a difference, right? And I think those are important. So.
It's wonderful to hear that the people that you talked to had so much information and resources for themselves, sort of already. But it's also very alarming that it's so common that there was so much preparation. And you talked about that statistic where it's one of the leading causes of death for young people. It sounds like the pandemic also was a change, but that there were already very high rates of suicide before that. Can you tell me a little bit more, like what were the factors that were contributing to that peak in 2017 for suicide rates?
And I did not research that specifically, and I would have to compare back to, the 2050, look at the rates back and see if that was just a spike in that year. So I can't exactly speak to what the specific reason was at that time. So if it was just being looked at, or like finally someone was asking those numbers and such, but I don't have that. Sorry. Thank you, though, Rita. That's a good question to see what happened in that time frame that caused that spike.
I do know there are conversations and research out there that's looking at the impact of social media, looking at, what that impact has, good and bad, there are different elements to it, but specifically 2017, we'd have to kind of take a peek at that and see. Any other questions or even comments? Maybe, anything anyone would like to share on this topic?
Yeah, if you have knowledge or resources, please, we'd love to let you open up and share. You could type in the chat. I believe everybody's muted, so you might have to type in the chat if you had any further resource to share. We're just sharing our information here, but we know there's a lot of experts in our setting here. you're able to see the chat, Rita, because, okay.
Yeah, I've got an eye on the chat as well.
Oh, you're fine.
Well, I might, we are starting to approach time, so I will make one last call for anyone. If you've got some burning questions or any just comments as well, you're welcome to make those now. But let me give just a few announcements as we wrap up. Absolutely, thank you so much to Margie and Heather for this presentation. It was so amazing to hear you speak, and also thank you to Dennis for the tech stuff behind the scenes that you were doing. Just a few more things. The slides and any additional handouts the speakers have provided are going to be available on Sketch. You can go right now to download their presentation if you like, and it will be available after the conference as well. Now, after the conference, you're also going to receive an evaluation via email. Please fill that out. Even if you've only attended a portion of the conference, it's very helpful for the planning committee to get your feedback about what's working and things like that. We are about to move into a 15-minute break before we have our next session at 2:45. There are 3 sessions that you can choose from at that time, and all of that information is available on the Sketch conference website. Oh, and we have, we'll just finish real quick. We have one question here from Joseph Harker. He wants to know, how did the acronym ACT come about?
I don't know if that was from the National Alliance for Mental Health or that, or I mean, acronym, just an easy way to remember, but I'd have to check that, Joseph. I'm not familiar with the origins of it. So we just like acronyms because they're easy to remember.
Yeah.
So, but thank you. Check that out.
And thank you all for coming as well. And we appreciate, listening to our, our research and our findings and our message.
Thanks for your commitment to mental health and your own health too. So appreciate it. Thank you. Thanks, Rita, also for your help.
And Dennis.
Dennis, yes, I see you on there too.
Absolutely. All right. Thank you all.